We would like to record this session, so I do want people to be aware of that. And if there are personal questions that you'd like to ask during the session, but not want it to be recorded, if you could notify us in the chat box, we can turn off the recording and go off that if that's important, and I respect that. My name is Jonathan Schwab. I'm a pediatrician at Northampton Area Pediatrics, and this is one of many in the series that we produce monthly through now remote. We've been doing this for many years now. The reason that we do these is we like to be able to educate our parents and help them with different aspects of medicine and pediatrics and child caring, as well as parenting, that we're not able to do in our actual office visits. So this allows us some extra time and also some time for our patients to ask questions and to get educated on things that we feel, and I hope they feel, are important to their children. Today, I am joined by Kit Bayer, who has a master's in social work and is a licensed clinical social worker. Kit, I've known for many years now. She's been a social worker for over 10 years, and I'm really pleased that she could join us today. She started in this area at our practice, actually seeing patients, and then and this was part of a really wonderful program that Boston Children's Hospital runs, and this is a program called PCP Plus now, and she'll tell you more about this program. It's really an amazing program. It's one of the first, if not the only, in the country that has the availability of specialists with substance use that can be available either in the office, but now remotely, to give that kind of care that our patients, particularly adolescents, need. Most pediatric offices throughout the country don't have this availability. And this is really a unique program that we're so pleased that Kit could join us today and also see our patients. So thanks for joining, Kit.
Thanks for having me.
Let me give you an idea, if I can, there we go, of what we'll be talking about today. Here's a little outline. I think to start this discussion on vaping, which is the topic of today, it's important to understand what vaping is. And many parents and people don't really know what vaping is. They've heard about it. So I'd like to go over briefly what that actually is, and then talk to you about what are concerns that we have with our patients, adolescents in particular. And those are multiple, and it has to do with the addiction potential for this substance, the substances that are in vaping, and also the medical consequences that these substances cause. I'll also go over some data about what who the people are in our community. I have data on Hampshire County in particular, and what the prevalence and incidence of the use of vaping is. And then I'll turn this over to Kit, who will talk to you about what can be done when you know or find out, or if you're not even sure, if your child is vaping. One thing in terms of today, we're scheduled to go to 5:30, but we probably won't be going then. And really, we want this to be very relaxed. And if you have any questions, please just feel free to either to put it in the chat, and we'll address them as we go along. So the first question is, what is vaping and what is a vape pen? This is an electric cigarette, and it shows you what it is how people use a vape pen. It has a mouthpiece, and then it has a cartridge that has juice in it. Juice is where the main substance that is vaporized, and almost all of them now have nicotine in them. And that's what causes the major problems, but other things as well, chemicals that we haven't identified yet, that could be carcinogens, and I'll get into that. But also they have smells and tastes and things that are very appealing, particularly to adolescents. So that juice is vaporized by using a heating element, which you'll see here, and then a battery which heats up the heating element. Now, many people, this battery can either be rechargeable Or sometimes now there are many that are one use, and people use them as disposable units. These things can look very different than the e-cigarette that I showed you there. This is a vaping pen. It looks like a regular pen that you might have in your pocket, but here's the juice canisters, and it goes in here, this pen area here, and you use it like as a vape device. Here's another one that you can't get the sense of what the size of this. This is the size of a credit card. It's that thin and that small, and it can be placed in your pocket and go completely unnoticed. Here's another one that is the same size of a credit card. Many people have heard that about the Juul. The Juul looks like a stick, a PC stick for a computer. It's recharged that way. And Juul, back in a few years ago, was the top seller. And they developed a really unique nicotine delivery device because it used a new type of nicotine that was particularly potent and also had less irritation to the throat. So what people said was that they developed this perfect nicotine delivery device, just as people were talking about cigarettes back in the 50s and even before that. And there's a lot of similarities about cigarettes use and the dangers of cigarettes and these vapes, because initially cigarettes were thought no problem, but now obviously we know a lot about the problems that combustible cigarettes can cause. Here's another side. These are vaping pens as well. Comes in many different flavors and comes in very different colors and is very appealing. So the question then is, why are we so worried about adolescents in particular? And the reason is because they are very prone to addiction and the dangers of these substances. And this gets down to how our brains develop. And I want to spend just a few minutes talking about that so that you can understand that. Here is a picture of the brain, and the brain starts in the back area in growth in the brainstem, and this is called the cerebellum, and it works up forward. This is called the nucleus accumbens, and this is the pleasure center of our brains. So this area is responsible for things that we enjoy or positive reinforcement. So that if you get a good test grade as a child, and you get lots of positive reinforcement from your parents, that center of area of the brain is being stimulated and causes you to feel good. And that's important. This is also the area of the brain that's stimulated when you have pleasurable experiences from drugs or sex or other activities. So this part of the brain is very active and fully developed pretty much in adolescence. The problem is that this part of the brain, the prefrontal cortex, is what controls our impulses. And that part is not completely developed. In fact, it doesn't develop completely until the late 20s. This part of the brain is responsible for what we call executive functioning, which means organizing, controlling concentration and focus, and controlling impulses. And if you can imagine, if your nucleus accumbens is actually not checked, then you start to go by all the impulses and things that make you feel good if you're not actually having the fully developed area here, which keeps those urges in check. So to put it in another way, this is the growth of the nucleus accumbens, and this is also a line showing the growth of the prefrontal cortex. And you can see that gap there. And that gap is what is responsible for many people, many young adults or adolescents getting addicted and doing things that they regret because they either are doing it impulsively or they can't quite yet control those impulses. So as a consequence, what you can see is, and these are two other substances, alcohol and marijuana, that at the youngest age that you start these things, you're much more likely to become addicted and develop a disorder of the use of those substances. So here we have alcohol, and marijuana. And you can see that if somebody starts drinking alcohol at a young age, they're almost 50% likelihood of getting a substance alcohol use disorder or alcoholism. And same thing with marijuana, and it's 17%. I couldn't find a graph showing nicotine, but I believe it's the exact same thing. That the younger you are, when you start nicotine, the much more likely you are and more vulnerable you are to addiction. This is another graph that shows basically the same sort of idea, and that is that most people who have drug problems start at a young age. And in fact, if you wait until you're much older to start use of these substances, you're much less likely to develop an addiction or problem. You can see that here. So that people who start, if you start at over 26, it's very unlikely that that will develop into a problem. And that's all has to do with the development of the brain and its ability and the difficulty in controlling the impulses. So just how common is e-cigarettes? Now, this has changed over the years, and I'll show you a graph of that, but it is very common. Almost 1 in 10 America's middle schoolers and high schoolers have used a vape over the past 30 days. Not only that, about 4 in 10 report frequent use of those who use, and slightly over 1 in 4 of those who use have daily use. So these are national statistics, and it's important to keep that in mind. And they're a couple years old. Here, I'd like to share with you, and this slide might be a little bit confusing or dense, but let me work it through you because I think it's important to see what's happening in our area. These are statistics from, it's called the SPIFFy survey, which is given to Hampshire County youth at grades 8, 10, and 12. And what you can see, and there's some good news here as well as bad news, so it's not all terrible that I'm talking about. But back in 2019, these were the percentage. I'll stick with the yellow, which is the 12th graders. Back in 2019, there was about 38% said that they used vaping within the past 30 days. That went significantly down over the pandemic, essentially, although I'm not certain that that was the cause. I think there were other things causing that as well, which we'll talk about, which is the medical consequences became more known. But it significantly declined. And now what unfortunately we're seeing is this increase. And it's hard to know where that's going to stop, if at all. But I think teenagers are starting to get back into it, and it's becoming more common. If we look on the right side here, this is comparing Hampshire County to the United States average. And you can see for our younger kids in particular, in our area, the blue line is higher than the, what would that be? Pink line. And you can see that the people for lifetime use for the past 30 years, that is 8th, 10th, and 12th graders, are less than the national average. If you look, though, over just the 12th graders, it's about the same or even a little higher. So we do still, of course, still have a problem. I'd like to show you some similar information about the use of cannabis, even though we're going to talk more about nicotine today than cannabis. Cannabis can be and is definitely used in vapes, pens, and in vaping devices. It can be used in that juice. And if we just look at cannabis overall, not just vaping, but overall, you can see there was this similar decline in 12th graders and other grades between 2019 and 2021, but a much larger increase. So now we're at, for the 12th graders, a 28% increase over the past 2 years. This is quite concerning. Again, comparing the United States average to our Hampshire County here, you can see that the younger kids are about the same, a little bit less, but this is very concerning. You can see that there's a 34% more likelihood that somebody in Hampshire County the 12th grader is using cannabis compared to the national average. So this is something that I think we're going to be seeing more and more of. Why is this happening? We don't have time. I don't even know. I think that there's a lot of theories. and people can talk about why that's happening, but I don't know the answer. Now, where does vaping occur? Now, a lot of people have talked about this happening in schools, and it certainly does happen in schools. In fact, when I talked to students about this, when students said that they don't have bathrooms anymore, they have vape rooms, because that's where where the students will vape, and the vape can sometimes not be smelled and can be very easily used there. However, if you actually ask the students where are they more likely to be using it, it's actually at home. So this is happening literally in your backyard, and that's where it's happening mostly for everybody, and particularly the older kids. So, what is the concern about vaping? And the biggest concern, these are the concerns here. I'll go through them one by one. Nicotine may be the biggest concern, and I'll talk to you about what that is. But in addition to nicotine, there are many other things. Glycerol, there are organic compounds, there are other particles within the vapor that can cause cancer. There's heavy metals in them. And then there's caustic aspects and chemicals that can cause lung problems. And I'd like to tell you more about that so you understand it. Also, there's good studies showing that other consequences are chronic bronchitis as well as sleep disorders. The thought is that the nicotine itself is causing the sleep disorder, but there's clearly an association of vaping and troubles falling and maintaining your sleep. So is the vapor really harmless? I actually remember clearly back, I think it was in about 2006 when these vape pens came out. And I was getting educated myself from my patients. They would say, "Oh, I have this thing," and what is that? And I remember one person explaining to me, one of my patients, that this was a new thing, but it's been shown to be, it's very much safer than cigarettes. And I just took it all in. And at that point, we really hadn't studied it, and we really didn't know. Now we know a lot more, and we know what's actually in the vapor. And these are the many chemicals that you have been found in the vape itself. And you can see many of these are benzene is a carcinogen, formaldehyde. So these things have been found in the vape itself. Lead in particular. There was a recent study that showed that from University of Nebraska just last week that I read that if you take teenagers who've been vaping, they have a high secretion of lead in their urine. We all know that lead can influence your neurologic system. So we really are just beginning to show and prove all these things, just as it was, as I said before, with cigarettes. Because we didn't know what was happening when these things first came out, there was this assumption or hope that this was going to be a safe device. And unfortunately, that is not the case. In addition, e-cigarettes can cause lung injury. Now, you may have heard of this thing called EVALI, which is a medical term. It's e-cigarette vaping associated lung injury. Back in 2019, there were these reports, thousands of them, of people, particularly young adults. About 80% of the people with EVALI were younger than 30. And they were coming in with significant respiratory distress, chest pain, cough. There were symptoms such as flu and fevers and chills, weight loss, and even GI symptoms. And even in that first year or two, there were about 100 deaths. So this was not just an insignificant, rare event. I want to show you what EVALI can do. This is, for reference, this is a CT scan of a chest. This is the lungs, and the dark area is lung tissue. The darker areas in here are blood vessels, but this is normal. If you compare that to this is what you see in people with EVALI. The lung tissue gets very congested, inflamed, and you can imagine that it's very difficult to breathe. So this is a very significant problem that we really still don't exactly know why vaping causes this. There are two proposed mechanisms which are probably related. One is vitamin E that has been used in the vape juice, and the other is marijuana itself. Most of the people with EVALI made their own juice cartridges with marijuana and had vitamin E in it. But we really don't know that yet. So then what are the consequences of nicotine? Nicotine is one of the most addictive substances we know, and I'll show you a graph showing that. In addition, as I've referred already to the developing brain, nicotine has been shown to cause learning problems in the prefrontal because it affects the cerebral cortex. It can cause mood problems, impulse control, again, because of its effect on the prefrontal cortex. And it's also been shown that it can lead or prime the brain to be susceptible to further addiction of other substances. So nicotine is not a benign substance. Here is a graph, and this was an eye-opener for me. If this is a graph showing the addiction potential of certain substances, meaning that if you start this substance, what are the chances that you will become addicted to it? And you can see by the different substances that tobacco, because of nicotine, is almost 30%, and that's even higher than heroin. I'm amazed at this. I mean, I always thought that heroin was the most addictive substance known to us, but actually tobacco, or nicotine in particular, is actually more addictive. So I have seen and still do my patients who come in who are vaping and actually are addicted to the nicotine, want to stop, and actually can't. So we'll talk about how you can help somebody who wants to stop, and how actually there are many patients who actually don't think that it's worrisome. And we can talk about how to deal with that. So why do youth actually do this? And studies have shown that many people, many of the adolescents start to do this because they feel anxious, stressed, and depressed. That accounts for many, or if not most, of the teenagers that I see at some point in their adolescence feel this way. And what they're doing is we call self-medicating. They're trying to help themselves through a difficult time. Some of them do it for the buzz that you can get with nicotine because it can produce a high feeling. They do it because of socialization reasons. Friends are using them. You also can do tricks. That is, the vape itself can be fun to use to develop certain types of smoke-related tricks. This is the national reasons. I just wanted to show you why our kids, that is the people in Hampshire County ourselves, are using it. And a lot of them, I'm going to show you, are using it for curiosity. They try it, so your friends are doing it and they're curious about it. Of course, the problem with that is, as we said before, is that nicotine is such an addictive substance that what starts out as a curiosity becomes a habit and an addiction. And this is what we're seeing in our practice. Also, people are using it, 12th graders, because they're bored, and other things that we mentioned before, such as anxiety and stress, and using it for self-medication. As I said before, also, that many people are using cannabis are actually using it through a vape pen or a vape device. So the juice has THC, which is the active ingredient for cannabis. And nationally, about 35% are using cannabis in this way. Here's another slide showing what's happening here in Hampshire County. So again, this is from our local area, and you can see that this is for cannabis. About half of students are smoking it, but 35% are using vape pens, or vape devices to use cannabis and THC. And here is on the right side here, this is what's most concerning to me. If you look on what the trend is up 82% from that 35%, which is the last in 2023, from 19% in 2021. So this is a huge increase, and I'm concerned that this is only going to increase more as more people are doing it. Now, many people have heard, well, isn't vaping also help? Can it be a good thing for some people? So what this is referring to, I think, is that isn't vaping better than cigarettes? And there is some data showing that vaping might be less carcinogenic and also harmful than the combustible cigarettes. And there's also some data in adults showing that you can kind of wean from cigarettes to the vaping devices and then hopefully uh, stopping. So there is some data showing that. The problem in my population is that adolescents go the other way. And this is clearly shown in studies. They start vaping, they get addicted to nicotine, then they have cravings, and cigarettes are often more easily available from them, their friends, or in the community. And it also has a less expense to it, so that they just naturally go from vaping to smoking cigarettes. And it's also been shown to be a gateway not only to cigarettes, but to other drugs. So the population I care most about, vaping actually goes the other way. So then, now that we've outlined what are the concerns about vaping, who's vaping, what can we do? And this is something that I want to make sure that people understand is certainly there are things we can do. And it wasn't always this way. Back 20 years ago, when I first heard about this, or somebody who had a substance use problem, I was really uncomfortable because I didn't know how to help our patients. And we didn't have the resources that we have now. And I hope that people in the community understand that we do have more resources. So the first thing is that a provider at NAP or any pediatrician can help make that diagnosis by talking to teens about their use or talking to you about your concerns. And then we can do treatments ourselves, as well as make referrals to people in the community, like Kit, who you'll be hearing from shortly, who can help them get away or turn away from these substances. So what does a pediatrician do? Well, the first thing we do after identifying the problem is help them with nicotine withdrawal. So first we educate, and if they're interested in if they're addicted and trying to get away from nicotine, they can't often do it on their own. Most adults have trouble enough doing it on their own. But for an adolescent to try to go through nicotine withdrawal, that is a very difficult task. Because nicotine withdrawal causes irritability, restlessness, anxiety and depression, sleep disturbances, concentration problems, and then you have cravings for it. And these can last for a week or many weeks. So what we do as a pediatrician can help them with each individual aspect of that, in addition to what Kit will talk about. But there are things that we can help sleep, with anxiety, and that irritable feeling. In addition, what we can do, I'm going to go down to here, is talk about nicotine replacement. Nicotine patches are very helpful in reducing cravings that you get from nicotine withdrawal. The problem is that they're not approved you can't go and buy one until you're 18, but you can get them with a prescription from a provider. So that is something that I do prescribe, along with nicotine gum, to do it in a safe way and wean the cravings that occur with nicotine withdrawal. There are other medications. I've used Wellbutrin for this. Wellbutrin is bupropion. That helps reduce its nicotine cravings. It's also used as an antidepressant, but that can be helpful in these situations. There's also medications that can be used if you're using vaping and addicted to cannabis or having cannabis cravings, and that's NAC is called, N-acetylcysteine. And this is an off-label use, but something that's actually over the counter that has been shown in double-blinded controlled studies to be helpful in reducing the cravings for marijuana and therefore reducing the use. So there are definitely things that we can do. And then Kit is going to help us understand the behavioral management. I am going to stop there. And before I hand this over to Kit to talk about her work and how she can help adolescents with this problem, I just want to make sure, see if there's any questions about the vaping, about vapor, about nicotine or THC or anything. Any questions that you'd like to ask at this point? Okay, I guess I would go on and introduce again Kit Bayer.
I
Oh,
actually had one quick question. You know how along the way when there's been matters of substance use abuse and there've been youth willing to be part of a panel or do like an assembly or a class to class kind of overview, so it's older teen to younger teen or a 20-year-old to teens, kind of like just FYI, like I used to be able to hike and I was an athlete, and now I can barely get out of bed because I'm wheezing. Like, not to exaggerate, but youth to youth sometimes can give a message more effectively about how dangerous this is. To your knowledge, has there been like a youth panel set up to try to address this issue of the long-term damage?
I'm trying to think. I'm not an expert in that area, and I don't know of any. There is the Northampton Education Collaborative, which has done a lot of work in getting this message out, and they would be the right people to know about that. I think it's an excellent idea to have peers giving information about this is much more receptive sometimes than adults, right? So I think that's a great question. And if you don't know the Northampton Education Collaborative, they have a good website. I can go and check and see if I see anything like that. And I'd love to get involved with that too.
That would be great. I used to know people who had some kind of grant called the Spiffy grant, and
Yeah,
and they did some trainings, but I guess it was always geared more toward adults, educators and parents. So I'll see if I can find somebody there who could tell me if they've. Yeah, that's a good idea. I kind of forgot that they had. Maybe it's even still running if they still have the grant money.
I think
Yeah.
they do because
Oh, okay.
the information that I gave you was from the Spiffy surveys.
Oh, okay. Oh, great. Okay.
In
Yeah, thank
county.
you.
Mhm.
There's also the Northampton Recovery Center. There is for cannabis, they have a Marijuana Anonymous group for young adults. There are also several online and virtual support groups. I haven't been asked about nicotine or looked into it, but I would be happy to. But there are some peer-to-peer and addiction recovery coaches for cannabis, where people share their stories with someone who's been, and they have special training to provide to support to someone who's trying to stop using nicotine or cannabis.
Right. But the Northampton Recovery Center is more for adults, right?
They do have a
Yeah.
for teenagers. They do have a couple programs for older
Oh,
teens.
oh, okay, great. Thank you. Yeah.
You're welcome. I'll also talk to you a little bit about some support groups that we have. My program, Primary Care Plus, has just started running as well, which I can get into a little bit more later.
Why don't you go ahead, Kit, and start
Awesome.
your side of the presentation?
John, thank you for the providing the statistics, excuse me. It's really helpful to see what is going on in our community. Just share these slides for us. Can everyone see this okay? How's that? All right. Well, I am Kit Bear. I'm a licensed clinical social worker with Boston Children's Hospital. I work in their program called Primary Care Plus. We're a part of their division of addiction medicine. we call our program PC Plus, otherwise it's a little bit of a mouthful. But PC Plus is a virtual care and consultation program for adolescents and young adult patients who are using substances. What is really neat about our program is that we are connected to primary care practices throughout the state, and are able to deliver substance use care to patients all over Massachusetts in their medical home. So for example, we work closely with NAP, and Dr. Schwab might have a patient and make a referral to our program, and they would be signed to one of our social workers for therapy. And thinking about the medical home, it's that the patient is at home, still able to go to school, but we're working to provide support and therapy to the patient, and also connected with their primary care provider. So if I had questions about medications, or maybe some other symptoms that are occurring for this patient, Dr. Schwab and I can collaborate together around how to best support the patient that we're caring for. So our services are completely virtual. And I actually have found that a lot of teens really enjoy being virtual because they can sign on anywhere. There's a lot of autonomy in being able just to pick up their device and sign on for therapy, and not having to go to a waiting room or get transportation. And so we provide individual therapy, but also parent and caregiver guidance. Sometimes that is, providing providing education around substance use, because there's so much to know and so much information that is changing, but also working with parents to help develop appropriate and effective strategies to help them support and respond to their young person who might be using substances. Our program is through referrals from the primary care office. So if this is something that, just in hearing this information, or, thinking about later, I would recommend talking to anyone at NAP can help you connect with our program. And one of the things that I was mentioning earlier is we just started a couple different support groups for patients and parents as well. We have a 14 and 15-year-old patient support group based in DBT and dialectical behavior therapy and cognitive behavioral therapy, which I'll also explain in just a minute. We have a high school group, 16, I think they're 16 to 17. And then we have a young adult group as well, and 2 parent support groups. There's been a lot of interest in the support groups for teens and for parents. Often both patients and parents can feel really isolated in these experiences. For a patient, for example, who's really struggling with trying to stop using, to be in a group with other teens who have similar issues, similar struggles. There's a lot that they can learn from each other. And there's also a sense of support and connection that comes from being with, someone their age that really gets what they're going through. And parents as well, it can feel really isolating to be caring for and taking care of, but also loving a child who is struggling with substance use. So to have some support from parents who know what that experience is like can be really powerful and encouraging, and make parents and patients feel less lonely, which is so important. So the one thing I want to touch on is some of the terminology around substance use. Terminology has really changed and always changing, but there has been a lot of awareness around some of the terms that we've been using over the past years around substances and substance use disorders that were very shaming. That there was a lot of stigma and judgment associated to those terms that created a different layer of complications and challenges for someone who has a substance use disorder. So this is a list of some terms that are very common and still used very frequently. And then some recommendations to change the language that is person first. That takes the person being the problem away from conversations. And yeah, so instead of the word drug abuse, we like to use substance use disorder and addiction. Instead of abuser, addict, junkie, or alcoholic, saying a person with substance use disorder. This can be a challenging, these terms, addict and junkie and alcoholic, can be challenging. They've been such a part of our culture when we talk about substance use that oftentimes it is the word that comes to mind. Also, very frequently, it's how patients identify themselves around their substance use. For some people, for some patients that I work with, that is how they want to identify themselves, as an addict. For other patients that I work with, a part of education is teaching them that they don't have to be that label. There are other terms, other ways to describe their substance use. Another term, clean, can have a lot of negative connotations and stigmas. So using the word abstinent, or not using, or a negative test, and talking about drug testing. Dirty is another word that we, instead of using that, trying to use actively using, or a positive test. And we won't get into these terms today, but just for education and going forward, if someone talks about an addicted baby, instead of saying, using that label, describing a baby with neonatal abstinence or opioid withdrawal. And medication-assisted treatment, medication or treatment for substance use disorder. So those are just some terms and terminology, and just a way of thinking around, talking around substance use that I wanted to share with you all today. To dive into vaping a little bit more, John gave some wonderful statistics and slides about what the signs are of vaping and devices, and I wanted to share just a couple more and talk a little bit more about those as well. One thing that I've noticed in my work, and maybe even you all picked up on it, is that there's a lot of confusion around vaping, because we talk about vaping nicotine and we talk about vaping cannabis. And it can be really difficult to know when someone says vaping, are they talking about nicotine, or are they talking about cannabis? One thing that I've noticed in my work is that a lot of the patients that I work with will say vaping when they're referring to nicotine, and will say smoking when they're referring to cannabis, even if they're vaping cannabis. And one thing I will also talk about later is with my patients, and when they mention vaping, always curious about and ask them what that means to them. And something that I would empower you and encourage you to ask about too. It's okay to ask that question. It's not a stupid question. It's very confusing, and how teens reference vaping, nicotine, or cannabis can be really confusing. These are some other vaping devices and chargers for the devices. Some signs of a young person that might be vaping nicotine are a sweet scent in the air. A lot of, even though flavored nicotine vapes are not allowed in Massachusetts, a lot of patients still have access to getting those. Unfamiliar pens or devices that look maybe like a USB or a highlighter that John showed us. They are everyday looking objects, and that can also be really confusing. For cannabis, these are some different pictures of oil, the flower, and also what would be put in a dab, the wax. For cannabis, some signs that you might notice are and nicotine as well, chargers or devices that go missing. Oftentimes, young people will use charging devices for other devices in the home to charge their device. And so that's sometimes parents, I have a lot of parents that I work with are, wondering why certain devices or charging devices go missing. Or, sorry, I'm going to try to get out of the sun here so you can still see my face. And so just something to be aware of. Also, excessive hunger, change in school performance, poor coordination or slow response, red eyes, dry mouth, and for both nicotine and cannabis, feeling anxious or irritable. A lot of the withdrawal symptoms that the patients that I work with report are feeling really irritable, really frustrated, short-tempered when they're going through withdrawal from nicotine or cannabis, and also trouble sleeping. When we think about substance use disorder, there are risk factors and protective factors that put a young person, that influence a young person and possibly developing a substance use disorder. Some of the risk factors are family history of substance use, parent engagement and monitoring, not necessarily around substance use, but generally, and being a part of their child's life, family rejection of sexual orientation or gender identity, association with delinquent or substance using peers, as some of the statistics that John showed, that there's a pretty high number of people in Hampshire County and people that are using nicotine and cannabis because their friends are and they're curious about it. Lack of school connectedness, low academic achievement, and mental health issues are other risk factors for developing a substance use disorder. Protective factors, which we'll talk a little bit about today, is the hopeful part of this, that there's a lot that we can do as providers and as parents to help our young person and grow up to make safe and healthy decisions around substances. So some protective factors are parent and family engagement, family support, parental monitoring, family bonding, and school connectedness. Today I'm going to talk about, I have kind of 4 components when I think about substance use treatment: medications, behavioral interventions, family support, and community support. Today I'm going to talk about behavioral interventions and family support. John talked about medications, which was wonderful. So when in my position, when we think about providing treatment for substance use, individual therapy, there are different treatment modalities that we use. Cognitive behavioral therapy is a form of psychotherapy, talk therapy, where the idea is that our thoughts affect our emotions and our emotions affect our behavior. And so working with young people to educate them around and becoming aware of their thoughts and their feelings and how that influences their behavior. It can be really powerful to have that awareness about how our feelings affect our behavior and vice versa. Another type of treatment modality is called motivational interviewing. And the goal for motivational interviewing is, rather than imposing and putting pressure on someone to change, motivational interviewing empowers the patient to identify what their motivation is and their reason to make change. Motivational interviewing can be incredibly powerful because as a provider, even as there's some strategies around parents using this as well, where it's allowing your young person to be the expert in their life and to share what their values are, and a way of really allowing them to be seen. and meeting them where they're at. Narrative therapy is another treatment modality that we use. This also, helps a young person embrace being an expert in their lives, to identify what their values are, and to learn skills that allow them to live by these values. Oftentimes, there's a really fun exercise that I do with some patients, and there's a long list of different values, of going through what values they are, and patients will pick out and number what is most important to them. And it's really interesting to see sometimes there isn't the awareness that what their values are don't align with some of their behaviors. So narrative therapy can be a really powerful treatment modality. DBT, or
Did everybody else
training.
lose? Get? Oh,
Oh, did I freeze?
Yeah.
Am I still here?
you're there. Yeah,
Okay. I was talking about dialectical behavior therapy. Did I cut out for that?
that's right. That's when you cut out.
Okay. DBT is a form of psychotherapy focused on skills training, emotion regulation, interpersonal effectiveness, and distress tolerance. It helps teach patients skills to manage really intense emotions, cope with challenging situations, and improve relationships. There's a lot of teaching in dialectical behavior therapy around skills, so that when there is a feeling of anxiety or fear or a craving, how to manage that distress. And it's one of my favorite forms of therapy, because there are some real concrete skills and tools that you can use. And being a visual learner and someone that is hands-on, that is something that I really have enjoyed teaching, but a lot of patients that have learned similarly also enjoy as well. And family support. So there are different interventions that you as family and parents can provide to your young person, to help them if they're using substances, or to help support them being a young person and being in high school around other adolescents who might be using substances. So one thing that we'll talk about are behavioral expectations, and I'll get into that a little bit deeper. I mentioned already parent guidance, parent support groups, and family therapy is not something that we provide in our program, but something that can be incredibly helpful. So in thinking about interventions as a parent or as a caregiver, communication is such a crucial component to all of this. And also, we talk all the time, we have conversations all the time, but effective communication and healthy communication can be really challenging. So these are some strategies to communicate effectively, calmly, and help have conversation with your young person. Open-ended questions can be a great tool. Asking a young person if they are talking to you about their thoughts about homework, or their thoughts about maybe a teacher being hard on them, being curious about it and responding with, help me understand that, tell me more. What do you like? What do you dislike about that? What's your biggest concern? What do you wish I knew? These questions are about being curious. And in being curious, you're also allowing for your young person to share their values with you, to share their perspective. In asking open-ended questions, you are inviting them in for conversation, but you're also seeing them for what they're sharing with you. And that can be really powerful, and help you tap in also to what their motivation might be around something. Another helpful communication strategy is affirmations. Affirmations are very different from praise. Affirmations are not about evaluating if that young person met your expectations or not. Affirmations are recognizing the effort or the skill or the values demonstrated by something that the young person accomplished. So for example, praise would be, great job doing your chores, versus affirmation, thank you so much for doing your chores. Or praise might be, you're so smart. Whereas affirmation might be, you studied so hard. So recognizing that effort that your young person put into something can be really powerful as well. And reflections. Reflections show that you're listening and trying to understand their point of view. It shows interest and shows respect to your young person's feelings, values, and motivations. Reflecting back something that your young person said really allows for them to be heard. If you think about a conversation that you might have with someone, you share something with them and they reflect back to you what you shared, you really feel held and seen in that moment. And so offering the same to your young person. These communication strategies are also a way of modeling for your young person how to communicate effectively. It's allowing you to learn more about them, but it's also and allowing you to have some healthy conversation with them, but it's also showing them how to communicate as well. So thinking about having some healthy and good communication, thinking about strategies of family-based interventions. There are some techniques for interventions and kind of activating those protective factors. So set boundaries and provide clear expectations. Identifying high-risk situations, emotional behavior triggers for substance use, developing strategies to cope with those situations and triggers. So this is thinking back to that communication piece, having conversation with your young person if they are using, or even if they're not using, about what are some difficult situations, where are times where you notice that maybe you're feeling frustrated at school, or when are times where are difficult for you in school, and working with them to develop some strategies or tools to manage when things feel complicated or difficult. And what we talked about earlier, clearly and effectively communicating, working on some of those communication strategies and teaching those to your young person. Supporting positive change is another big intervention, and might seem kind of simple, but it's providing reinforcement for positive behavior, whether that's doing the dishes or chores, or at school or work, or around abstinence, if that's a conversation that you're having with your young person and they're open to you about what their abstinence look like, recognizing that positive change. Even, if it's 2 days of not using, that might be, your goal is obviously most likely going to be for them not to be using. And you're recognizing that they have put this effort in, and it's a small step and a positive step, positive change. And improving your emotional connection and your bond with your young person. Our lives are really busy. Smartphones and devices are all over the place. So really setting aside some time, whether that's something that you have to carve out as every Tuesday at 6 o'clock is family time, or something that you try to weave into your day or your week. But having some moments where you are engaged in discussion, you are having conversation where devices are down, where you're really interacting and seeing each other. Again, for that bond with your young person, but also a way of modeling, how to feel connected to someone. And the last big thing I wanted to talk about was behavioral expectations, and thinking about, and and before I go there, just talking about boundaries too. And thinking about substance use, a lot of the parents that I work with, there's the assumption that your young person knows what the house rules are around substance use, knows what the risks are, knows what the has the education about the substances that are out there. So one thing that is really important is setting really clear boundaries with your young person around what your rules are and values are around substance use in your home. And that doesn't have to be a serious conversation, or very formal, but making it clear, making it known, and something that can be ongoing as well. It's one thing that, as John was talking about the brain and the development, that there's so much going on for our teenagers, that having clear boundaries can give structure and feel safe. So setting boundaries for your young person is an important part of that, important protecting factor, and helping keep them safe and helping them make healthy decisions. So behavioral expectations, this is something that often is a part of our parent guidance when a young person is using, to help your young person make healthy decisions, to have some structure, and to have some support. So usually we recommend having 5 areas, no more than 5, of what your expectations are for your young person. And this is an example. So this example is grades, physical wellness, emotional wellness, extracurricular activities, and contribution to the household. With each expectation, there's a goal and it's measurable. There is no ambiguity in what the goals are, or what the rewards or consequences are. It's very clear. And there's a timeline that allows for evaluation to see what the progress or the positive change is. So as an example, grades, the goal would be to maintain a B or better in every class. And then if they meet expectations, for every B, you earn 2 hours with friends. And if they don't meet expectations, for every grade below a B, you lose 2 hours of time with friends. This can be, and kind of going through, I won't walk you through each one, but this can be a really helpful way to create structure for your young person, and also to provide more monitoring, engagement, and conversation. There are opportunities here with these different areas, around grades or physical wellness, to ask questions. How's that going? What was that like? What did you like about that? What did you not like about that? So this can be a really helpful tool, and even creating it in this chart like this, and putting it in a place that's central for both you and your young person, so that everyone can see it. There's not any secrets about what the expectations are or what the consequences are. This is obviously something that is a conversation that's put together by a conversation that you would have with your young person. You have your boundaries and your values as parents and in your home, but the expectations is agreement that this is something that we want to do to help support you, and that allows for them to be a part of the conversation, to give their feedback about, what do you think is a reasonable goal for grades? If you meet that expectation, what do you think is a reasonable reward for that? And if you don't, what do you think is a reasonable expectation? And taking into account your young person's feedback, again, as a way of hearing them and seeing them, and also understanding what motivates them as well. So that is the end of my talk today. These are some resources that I put together. One of my, I just want to note, one of my favorites is the Parent Support for Effective Communication, the School of Hard Talks. They have some wonderful video, like cartoon videos, but also they have some videos with actors, but it can be, there's some really helpful strategies that kind of reinforcing and going over some of the things I talked about, the communication strategies that I talked about. But it's something that I've really enjoyed and has been helpful to me and some of the conversations that I've had. So I wanted to point that out there. So I guess I will end it there. Does anyone have any questions?
Thank you very much, Kit. I really enjoyed hearing about that side of what you do over up in your office and helping parents. I have a question that I get often asked by parents, and I'm wondering how you might answer this.
Yeah.
Not uncommon for the teenagers not to identify that they're using substances, let's just say vaping in particular, and not acknowledging the dangers associated with it. Whereas parents are very concerned about it, and understandably, as we've pointed out here. How could you counsel a parent how to approach that? And I can say also, I have referred you, parents, to talk to parents about this. So I know that you do that kind of work without the patient there.
Yeah, that's a great question. And you are right. A lot of the referrals that we have, a lot of the patients don't identify their substance use as a concern. And so the work that I do is around trying to figure out what how the substance is, I guess what that is, how that's taking care of them or what the role that plays in their life is. So asking questions around, being curious about it. If you know your young person is using nicotine, asking them what they like about it, what do they not like about it, to help understand some of their motivation around use. For oftentimes the answer that I get to that question is, it makes things makes the everything go away for a couple seconds. It gives me a buzz, and all my anxiety is gone. And that opens up a door to talk about anxiety. What are your anxious feelings and thoughts? What makes you feel anxious? So being curious around their use, and also providing education. There is not around nicotine and cannabis. It doesn't have to be, a formal sit down and let me tell you all the facts, but I think a huge part of helping your young person is educating yourself about the facts of nicotine and vaping, what some of the risks are, what some of the statistics are, so that you can share that with your young person. Because oftentimes, especially the younger kids, the early teens, they don't know what the risks are. They don't know about the carcinogens in e-cigarettes. They don't know about the high potency in a dab. So providing some of that education can be really helpful to your young person, because that allows them to be aware, and also gives them some information that they might not be getting other places.
Thank
I
you.
hope that answered your question, John.
And actually, there's a question now in the chat which I'd like both of us, I think, address. Very good question. Much of the literature focuses on addiction. Do you have any recommendations, resources for a parent who believes that recreational use has not, or at least anyway, not yet, reached the level of addiction? I'll start by answering.
Yeah.
I really, and as you, I really hope that's not what we've been presenting here, because I feel that we're talking about substance use. For the most part, what I see, most of it is substance use and not necessarily addiction, but substance use. So I would, and then there are also categories of substance use disorder, which means it's gotten to a point where it's actually interfering significantly with one's life, whether it's school, friendships, relationships, family, and what have you. That's a different category. Everything that we're talking about in terms of getting help for kids or your patient or your children has to do with not just addiction, but substance use. So any kind of use, whether it's very infrequent, that's a problem, and it can lead to more problems, but that's often a problem in and of itself. So I would like to be able to help your patient and my patients who are using it all in any way. Now that's Kit, how would you answer this?
Yeah, I would say that any substance use for a teenager is concerning, even if they're don't have a cannabis use disorder or substance use disorder. That there are because a teenager's brain is developing, that there are changes to the brain that can be harmful to them, as well as using nicotine and cannabis puts you at greater risks for anxiety, depression, and also developing a substance use disorder. And there's also, especially around cannabis, there's more, John, I don't know if you've experienced this in your practice, but there's been more psychosis related to cannabis use. So it is, any use, I would say, is concerning. Yeah.
And I guess to answer also the question about resources. So the first thing is the resources that Kit had in terms of those websites are all related, almost, I think the ones I saw, to use at all. And then another resource is us. So if you have, I would say that if you have a child who you think is using substances or is using, and I would suggest that you talk to their provider, set up an appointment, even we call it a conference, where we have a little bit more time to sit down with the patient and say, hey, what's happening? What is the substance, or if they're admitting to it, and then we can determine how we can get help, so that use us as a resource, because I think that we can then either have discussions with them about what the negative aspects are, or why it is that you're using it, what are the benefits that you're receiving from this that you perceive, and how we can then get them help, either through KIT or through other things that I can do.
Absolutely. I would even just wanted to add that one of the, I think, really helpful parts of a parent guidance session is talking about the neurobiology of brain development and substance use, and going more into specifically nicotine or cannabis, just so parents can have that education. But if you want to do your own research or reading, SAMHSA has some wonderful education and resources for parents, and as well as some of the other websites that I listed in my resource section, which I can figure out a way to share with all of you, if that's possible.
Good question, Steve. Thank you. Are there any other thoughts or questions or things that you were thinking about on this issue? Well, I think we can.
I think we
Yes,
have one
Jan.
more question.
Mhm.
Yeah, I'm curious if, say, broaching the topic of substance use or possibly bordering abuse because it's so impacted the family's ability to kind of hang together and, sort of agree what family time is. Do you recommend any particular family therapy that can easily then lead into discussion of substance? Because I think some families, they actually just need family counseling, like straight up before you hit the heavy topic, you know?
Yeah. That's a good question. I don't have any, well, I guess before I answer the question, one thing that I think is really important um, in my position in this work is to, if a patient is not ready to engage in therapy, we don't want to force them into therapy. Um, especially for our younger patients, if they're not ready to do that work, we don't want them to get shut down and to turn them off to therapy maybe later in life. That said, there are many patients that I work with that don't believe their substance use is an issue or a problem, and that's okay. We will still meet with that patient and talk about what some of the other issues are, what else is going on, as a way of kind of beginning to have that conversation around the role that substances plays in their life. Oftentimes, that is where the work is. We say is meet the patient where they're at, is meeting them where they're at, and sometimes that's talking about depression or anxiety, or a trauma, and then we learn about how that relationship with substances has become a part of their life. So, if there are some Psychology Today, just for has some, you can Google search and filter by insurance and look for family therapists in the area. But also, if that's something that you want to talk about more, or you want some more thought out referrals, would be happy to figure out a parent guidance session for you.
Yeah, and I might say in addition to that,
Thank you.
it's just what you said. Many of my referrals to KIT aren't actually specifically about substance use. They're about, let's say, anxiety. And I happen to know that the patient is also using some substance. Um, that's the way KIT often will approach this, is just let's see what we can do to help with anxiety. And there are lots of things that she does to help with anxiety. And then sometimes the substances are then brought into that equation and gives advice and help in how to reduce the use of substances, which may be also contributing to the anxiety, or in the patient's belief that it actually is helping with anxiety, which is actually not usually the case. Any other questions? Yeah, yes, Jen.
Yeah, last thing. I really like what you just said about that approach, because maybe there's sort of a consensus kind of gradient, like you go through, like, is this truly helping anxiety or is it making it worse? Um, like, give examples, like peer relationships included, like outside of the family, and I guess it's like fighting against, like, some kind of societal belief that cannabis in particular is always a calming element, and just everybody's so different, that's not always true. Yeah.
Right.
That's a huge part of the education piece too that we do with patients and parents is, a lot of patients that I work with will say that they use cannabis because it helps them with their anxiety, but they don't know that using cannabis can increase their anxiety or put them, there can be paranoia that comes with cannabis use. So that can be helpful information, and also opportunity to have conversation around their use and other, if they're there at that point, that want to make some change, to learn some skills to manage anxiety, so that they don't have to use cannabis.
We do have another question about the fruity smell that's can be associated with vaping or cannabis use. I think that there is a unique smell that cannabis can produce, and then there are smells that can be associated with certain types of vaping, depending upon the kind of juice that is used, and there are different flavors and that people can get a hold of. So there are a variety of different smells. Some of them are fruity. Usually, that's associated with vaping of some sort. Well, I'd like to thank everybody. Unless any other question, I'd like to thank everybody for attending and your great questions. And I wish you all the best in terms of helping your patient, my patients, your children, in dealing with any of these issues. Please feel free to contact us. First, I'd like to thank Kit Bayer for joining us, and I'd also like to thank Jen Penza, who's our coordinator, who's on the line. Thank you very much, Jen. You're doing a great job of helping us coordinate all this. And if you have other questions, you can email contact us at napeds.com. And also, this is a series that we've been doing for years, and I'm always interested in getting feedback, either positive or negative, things that you think could be improved. In addition, we'll be in June thinking about our upcoming talks for the next year. And if there are any specific type of topics that you feel are lacking in your knowledge or understanding, please email us and we'll see if we can develop a workshop around that. Thanks again, and I wish you all well.
Bye,
Thank
everyone.
you.
Thank you. Thanks,
Thank
John.
you.